Some medical residents at St. Joseph's Healthcare are being put through the boot camp effort. But it's not a physical competition, rather it's getting them ready for the operating room. It's a unique simulation training program designed to get doctors ready for urology surgery. Sean Cowan shows us what was happening in the lab this morning.
It's almost like a real surgery, and that's the goal.
So essentially this would mimic working, in our situation, either in the abdomen or the pelvis. And so the idea would be that we have a bunch of keyhole incisions through which we put instruments, and so that would be right here. Putting the instruments through those keyhole incisions to then operate on the tissue or the model here.
These are meant to simulate different surfaces that you may work on in the OR. So this is more like superficial human skin. These textures are a little bit rougher, so they're meant to simulate like soft tissue and connective tissue. And these tubes are meant to simulate vessels that you may be tying in the operating room.
It's all part of a urology boot camp for residents at St. Joseph's Healthcare, created by Dr. Matsumoto.
And the idea is to prepare these first-year residents that come into a program and have the daunting task of looking after clinical patients and getting them up to speed. So, learning the basics. As the saying goes, you want to teach them to crawl before they learn to walk.
Part of the boot camp includes working with this robot, just like a doctor would during surgery.
Right now what I'm doing is practicing kind of handling the needle and simulating passing it through a bunch of rings, but it's to simulate being in the pelvis and suturing in really narrow, tight areas and needing to be very precise. And the robot allows us to do that surgically.
This program is up and running at St. Joe's in part due to donations from philanthropists. Dr. Matsumoto says that helps better train the doctors of tomorrow.
They allow them to practice in a very safe environment repetitively. They can make mistakes, learn from the mistakes, and hopefully by the time they come to the OR, they're going to be ready for their operating room exposures.
After the residents complete their simulation training, most of them will end up in the operating room helping out with real surgeries within a couple of days. In Hamilton, Sean Cowan, CHCH News.